Welcome to Phlebotomy Fundamentals. In this video, you will learn the step-by-step procedure to a complete EKG from the time of the greeting to the close. Let's begin. The greeting. Proper greeting technique will build a solid rapport between you and the patient. When you enter the room, introduce yourself. For example, "Hello, Mr. Smith. My name is Anthony, and I will be performing your EKG today." When possible, it is important to have eye contact with the patient. Ask the patient to change from the waist up and to place the gown with the opening in front. If the patient is wearing nylons, ask her to remove the nylons as well. The sensors pick electricity from the skin, and the nylons will interfere with the recording, causing artifacts to appear on the recording. If the patient is wearing slacks, ask the patient to roll up the pant legs to the calf. This is where you will be placing the lower limb sensors. It is also important that you ask the patient to remove any jewelry, including a second-hand watch. The metal from the jewelry and the second-hand movement from the watch can cause an interference in the EKG recording. For female patients, ask if their bra is a wire bra. If the bra has wire, the patient will need to remove the bra. It's important that you leave the room while the patient changes. Confirm the patient's identity. Ask the patient to confirm their first and last name and date of birth.
Can you just verify your name and date of birth, please?
Sure. Mike Jones.
And your date of birth?
It's 11/18/1985.
All right.
Explain the procedure. Explain to the patient you'll be performing an EKG and that you'll be placing sensors on their arms, legs, and chest. Have the patient lie down in the supine position or in a 30-degree angle. Turn on the EKG machine. Type in the patient's information. Just as a note, the patient's information can also be entered once you have placed the sensors on the patient.
Just going to have you lay back. Put these up. Just lay back here. And I'm going to put some of these stickies on you. I'm going to place leads on you, all right?
You may also want to let the patient know that they may feel cool sensation from the sensors. Ask the patient if they have any lotion on their skin. If they reply yes, then you should clean the areas where the sensors will be placed with alcohol. This will remove the lotion and make the area ready for sensor placement. Not cleaning the area with alcohol will cause the sensor to slip off, which will cause a distorted reading. It is also important when placing the sensors that you do not touch the adhesive portion. This is because your fingerprint will become affixed to the adhesive and can cause interference. First, begin placing the sensors on each limb. The sensors should be placed on the fleshy part of the skin. Do not place the sensors on bone. Bone is dense and does not produce electricity. Next, begin placing the chest sensors, also known as precordial leads.
It's okay.
There are 6 chest leads. They are as follows. V1 is located in the 4th intercostal space on the right side of the sternum. V2 is located in the 4th intercostal space on the left side of the sternum. V3 is located between V2 and V4. V4 is located in the 5th intercostal space, mid-clavicular. To make sure you have proper placement of V4 is look for the breast line. The nipple is your mark. Place the sensor on the breast line below the nipple. This is mid-clavicular line. For female patients, ask the patient to lift up their breast and place the sensor on the breast as mentioned. Should it occur that a patient cannot lift their breast, explain to the patient you will lift the breast and do so by using the back of your hand. The next sensor is V5. V5 is placed on the anterior axillary line on the same level as V4. V6 is located on the mid-axillary line on the same level as V4 and V5. It cannot be stressed enough that sensor placement must be accurate and performed with precision. Lead wire placement. Once you have placed the sensors, begin placing the lead wires. Each lead wire is marked. The limb leads are marked RA, RL, LA, LL. The chest leads are marked V1, V2, V3, V4, V5, and V6. When placing the leads, be sure that the wires are as straight as possible and not crossing over each other, such as V4 crossing over V3, as this can cause interference.
And I'm going to place these leads on you.
Okay.
I'm rest it right here. Is it okay?
Sure.
Okay, so far it looks good.
Thank you.
I'm going to go give it to the doctor so he can read it for you.
Okay.
Lead and sensor removal. Before removing the leads and sensors, show the completed EKG to the provider for review. Once the provider is satisfied, begin removing the leads and sensors. Remember to explain to the patient what you will be doing. For example, Mr. Smith, I will now be removing the leads and sensors.
So I'm going to remove all these leads off of you, okay?
Okay.
Removing the little stickies. Ready?
Yep.
Once all the sensors and leads are removed, assist the patient back into the sitting position and thank them and leave the room.
Right, so you can sit up. Doctor, and he'll be right in.
Thank you.